All right, folks, day 4 at Metabolic Health Summit. And I got to say, I'm really excited to talk to Beth here with the Charlie Foundations for Ketogenic Therapies because the this foundation is doing truly incredible work. I was extremely moved when I saw this presentation yesterday at the gala and how many lives are impacted by this foundation. So, Beth, first of all, thanks for joining us.
Thank you for having me.
Absolutely. So maybe tell us a little bit about the Charlie Foundation, how it developed, and where the Charlie Foundation is going.
So, the Charlie Foundation was started 30 years ago after young Charlie had gone through a whole year of medication treatment for his epilepsy. And he was having up to 100 seizures a day. And all available drugs were tried on him in different combinations. And then he had a brain surgery that was fruitless. It didn't improve him. And then his dad, Jim, who happens to be a Hollywood movie writer, went to a library at UCLA looking for some solutions. And he found in a book a chapter about ketogenic diet for epilepsy. And he took the book to Charlie's doctor and said, "What about this?" And the doctor said, "Well, we don't do that here, and I don't really think it works, but you can go to Johns Hopkins. They know all about this." So sure enough, long story short, they took Charlie to Johns Hopkins, put him on the diet. Within 2 weeks, his seizures stopped.
Wow.
And his doctor, Dr. John Freeman, who died a few years ago, but he so believed in the diet that he just kept it going. It was one of the few centers in the U.S. that were doing the diet still. He took Charlie off of his medications. Charlie remained seizure-free. He was on the diet for 5 years. I have to tell you, most children with epilepsy are on it 2 to 3 years, but he was on it for 5 years. They weaned him off. Charlie's in his 30s now, has not had a seizure since, has not needed medication. And so it was really, it was like a miracle. And his epilepsy was healed, and that's really unheard of with his type of epilepsy. So the family felt first anger, why weren't we told about this? And then they recovered, they went through that grieving process and they recovered and they said, we have to tell other people. And so they went on Dateline and told their story and then just received thousands of letters, and these are the days before internet. So Jim felt compelled to write a movie about one of the letters that he got about a family who had a kid just like Charlie. And that movie is called First Do No Harm, and it's still a media piece that informs parents and adults. Now, I'm talking about children, but this diet actually was started in adults, and it does work for adults as well. There's just a little bit less research in adults. So the Charlie Foundation became an advocacy and education organization, nonprofit. And I'm a registered dietitian, nutritionist. I brought the education piece. So we have gone to meetings. The Metabolic Health Summit has always sponsored us and honored us and helped bring in donations. Jim Abram's philosophy is that we don't accept donations from pharma because it's because of pharma that they didn't find out about the Charlie Foundation quite honestly. So we have developed over the years programs. I have a training program for dietitians that the Charlie Foundation sponsors, and we have been very involved with other organizations to bring this to rare metabolic diseases where ketogenic diet therapy is more first-line therapy. We also were integral to getting consensus guidelines written for pediatrics for use of ketogenic diet therapy, and that spurned consensus guidelines for adults, and that helped spurn consensus guidelines for using ketogenic diet for migraine headache and multiple sclerosis. So it's really, been effective. The foundation has been very effective in opening the door to other applications and getting researchers interested.
Think about that. Think about that reach of in terms of the foundation, using food as medicine in not only affecting so many lives with people with epilepsy, but other autoimmune diseases. As you mentioned, multiple sclerosis, migraines, adults, kids. Like this is huge, and I feel like we gotta toot your horn a little bit too, Beth. Like in terms of training and providing that education. Like when we say you've developed curriculum and so forth, what's been the level of outreach? Like how many centers are using specific protocols? Because I'm in Canada. I'm not aware. I'm sure there are centers that are doing this, but I'm not aware of any. But yeah, what kind of numbers in terms of outreach are we talking about?
Yeah, so I have gone to 300 centers, and that doesn't include the virtual program. With COVID, we went virtual with our training. Prior to COVID, we were going in person to hospitals. And I finally brought in Denise Potter, my colleague, to help me do trainings because I couldn't keep up with all the traveling. But we together have trained over 300 hospitals globally. We've gone into developing countries to do this.
Yeah, she was saying that you did Romania as an example.
She
went
did
to
Romania. I went to the Republic of Georgia. I've been down to the Caribbean. And I'm going to Jamaica again with an epileptologist this year who has connections down there to train more centers in the Caribbean.
Wow.
And so the Charlie Foundation actually helps sponsor those trips so we can make them available. We don't charge anything for those. But what I found, people are like, really? They'll do this in a developing country? I'm like, yeah, actually they do it better than developing countries because
Right.
there's a lot less regulation in a hospital setting to start something like this. And they don't have all the medications, so they're very open to a food-based approach.
Yeah, and we were talking a bit beforehand how hopefully this is more momentum that folks are recognizing food as medicine, that this is a great way in many circumstances to optimize their health or to remedy health conditions. So I hope the more awareness, the more opportunities organizations as yourself get to be out there, the more open-mindedness we have. Because I think, if I'm being honest, I think there's a lot of work to be done,
Yes.
but it's important.
Yes, and that is something I want to highlight. Despite the fact that we have now a lot of studies, we have 6 controlled trials in epilepsy. I'm involved in trials now for mental health. There's at least 6 controlled trials using ketogenic therapy in mental health. Despite all of this, it's still a highly underutilized therapy. And it's that education piece. Doctors currently don't learn about it in medical training. We're
Totally.
trying to change that. They tend to, and it's actually the younger doctors that are really interested, right? So we have a lot of work to do.
Yeah. I feel like that's a sweet spot actually, is the hitting the youth, the trainees that are more open-minded and willing to explore different areas. I think that might be the sweet spot. But Beth, thank you so much for joining us and really for the work that you're doing. It really is incredible. I got to sit next to Denise yesterday, and I was really moved by all the stories, and it was quite emotional actually seeing all the how your foundation has impacted so many lives. How do people donate? How do people learn more about the foundation?
Yes, so very simply, charliefoundation.org. There's a donate button at the bottom of that main page, and we also have a lot of resources, testimonials. We also maintain a global list of centers that do keto, not just for epilepsy. We're adding the mental health centers and genetic metabolic centers all over the world. So you can find out more if there's a place in your area that you can contact. And then we also have a list of virtual practitioners that will, for people that don't have a hospital in their area or even their country. There's virtual consultants that the Charlie Foundation's lists. And so Denise is one of those, I'm one of those consultants, and there's several other people.
Incredible. So grateful for you, Beth, and the work that you're doing. Thank you, those that are logging on to Metabolic Health Summit. Day 4 has been incredible so far, and we'll connect real soon on another live.
Thank you.